So I'm actually pretty excited to make this video because I'm hoping that we can talk about the ways that might make a pap smear easier, could help at least one person out there. In this video, we're going to go over all the different ways I can think of that hopefully we can make the pap smear hopefully a better experience, and so it's less of a barrier for people getting their care to this life-saving test. It matters where you get your information. My name's Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon. If you're new, welcome. We're in a series of pap smears, HPV, cervical cancer. If you missed the previous video, go ahead, watch that prior to this one. We have a lot to go through, and so let's start talking about how you can make the pap smear hopefully a better experience for you. Let's keep in mind that what might make this delicate exam difficult for one individual might not be the same for the other. So let's keep an open mind about these different ideas that I have to hopefully make the pap smear a better experience. Let's break this down into what you can do before the visit and during the visit. So first, before the visit, what you can do. If somebody's in their menstrual years, there might be a couple reasons why you might want to avoid getting your pap smear done if you are around the time of the bleeding or menses. Number one would be, well, during that time, the uterus is shedding and signing, and this can be a very inflammatory process, as I'm sure you're well aware, but all of those tissues in that area, whether it's the vaginal area or whatnot, can be very sensitive, more so at that time. And so that's why sometimes we might recommend, if possible, getting the pap smear done after menses or the bleeding at that point in the cycle. Also, the blood during that time can also obscure the reading of the cells on the pap smear. Now, with newer technologies, they're able to potentially account for this more and give better accurate results even if somebody is bleeding, but would be another reason to potentially avoid getting it done around the time of someone's bleeding. That being said, someone certainly could get their pap smear done while they're on their menses, especially if the bleeding is lighter. What you also might want to do is avoid a couple things before your pap smear, and this might be 1 to 2 days prior, just to make sure it doesn't interfere with the reading. But avoid any vaginal penetration, potentially any vaginal medications or spermicides or things like that. Again, 1 to 2 days prior to you getting your exam. Let's now talk about what you can do during your visit to hopefully make this a better experience. And the biggest thing you can do is communicate with the whole care team. Now, when you're going to the clinic for an evaluation or getting your pap smear done, you're likely going to first talk to somebody like a medical assistant or someone of the nursing staff that is probably going to take your vitals, get you to your room, and have those initial discussions with you. This is an excellent time to voice any concerns that you might have prior to seeing your provider, because I think for some reason, sometimes patients might be a little bit hesitant to express their concerns to the provider. And so talking to the medical assistant or nurse that is putting you in the room and doing that initial evaluation is a great time to do that, because they're a direct line of communication with your provider and can likely help answer some of those questions, maybe even before your provider comes to the room with you. So for example, if somebody has had really painful exams in the past, or if somebody's really nervous because this is their first pelvic exam they've had done, or if someone has a history of trauma, this would be an excellent time to let that person know or let your provider know that you've had those experiences in the past, because it is useful information. As the provider, I can often sense if there is an increased level of concern, or if there's an increased level of anxiety, or if this has been somebody's first exam. Rightfully so, it can be quite anxiety provoking. And I do think I speak for most providers in that we can sense that. And so we really try to accommodate, whether it's somebody's first exam or their 50th, we do try to take all those into account and to communicate and gain the trust of the patient the best we can. For example, there are a couple of rules that I have, especially as being a male OBGYN. I certainly know that can bring an increased level of anxiety initially, but a couple of rules that I have would be that I always meet the patient while they're dressed. I know that at some places or some situations, they might have you get undressed right away before you meet your provider. But for me, it's my rule. I always want to talk to a patient when they feel the most comfortable, least vulnerable, and to initially gain that trust before we go into any delicate exams. Now, another rule that I have, and I think often other providers will, is that I'll have somebody in the room with me. Again, gaining the trust of the patient and having somebody else there in case I need anything, but also maybe just a hand to hold or communicate with the patient along with myself during the exam. But if you're meeting your provider for the first time and you'd prefer one of these options, talk to, again, the medical assistant or the nurse that's working with you and say, you know what, I prefer to stay dressed and meet my provider first, or I prefer you be in the room with me during the exam. Vocalize those things. It doesn't hurt to over communicate in these situations. Now, with the patient undressed and we're about to do the exam, it's probably a good point to go over anatomy and terminology review. So, currently, with how we do pap smears now, it does require a pelvic exam, and that is, we have to be able to visualize and see the cervix, and we do this with a speculum. It's something we insert in the vagina to expose the cervix and see all the different areas. There are a number of different speculums out there, ranging in, they can be metal or plastic. Now, if someone does have metal speculums, they'll often warm them, so it's not a cold shock to the system, which I imagine could be quite uncomfortable. So you could, again, ask your care team, if it's a metal speculum, can it be warmed? And often I think they will do that if they do. And then there's also the plastic speculums. Both the metal and the plastic can come in a variety of different sizes. And often for some procedure as simple as the pap smear, we will be using likely the smallest one possible to be able to do the exam. Now, this could vary a lot between each individual, but often what we might do is start with the smallest one. If we're able to do the pap smear, great, and we're done. But sometimes we might need potentially a little bit bigger than the smallest to be able to visualize the cervix and complete the procedure. Okay, we've now familiarized ourselves with the speculum and the different types that are out there, and so now we're able to see into the vagina and visualize the cervix. Now, the cervix kind of looks like a donut. We'll put a picture up here, but we're trying to brush that area where the center or the opening of the cervix is. And really, this is a point of clarification. The cervix is part of the uterus. It's the opening of the uterus. And so we're seeing that very bottom part of the uterus, which is the cervix, and we're using either what's a brush or what's called a spatula to collect cells from that area and to send it off and get tested for the evaluation of the cytology and the HPV in some situations. Okay, so now that we collected the sample, we're done. And we're taking the speculum out and the procedure is done. A couple points to go back on. Number one, I think often patients might say, okay, a prior provider told me that my uterus is tilted or my cervix is tilted. And honestly, quite often this is the case for most individuals with the uterus, is that there often is just a little tilt, more commonly forward or backwards of the uterus. Now, sometimes this can be to the extreme. For example, if somebody's had C-sections in the past, that sometimes can scar the lower part of the uterus in a very particular spot, and it can be very sometimes difficult to see because it's so much more towards the anterior or like the belly side. This can make actually finding the cervix in these patients sometimes more difficult, but I think often sometimes if a provider who maybe doesn't do exams as much says tilted uterus or cervix just as a filler of time as they're actually trying to find the cervix, because in reality it should only take a couple seconds to do, but sometimes in some situations can take longer, so that might just be a filler of conversation as that person's doing the exam. Why does the provider ask you to scoot so far down and kind of have the bottom off the edge of the bed to do the exam? It's not because we want to give you the sensation that you might fall off. No, it in reality, it just makes it easier and hopefully less uncomfortable in the long run to kind of have the bottom part of the buttocks almost a little bit off the edge of the bed. Just anatomy wise, the speculum's able to visualize the cervix a little easier. And so that's why you might hear us say a little bit further, scoot a little bit further. It's almost comical sometimes how much we might have to say it, but in reality, we're just trying to make the exam easier for you in the long run. And one of my last rules of the exam is that I always am communicating. And so it doesn't just stop after I explain the procedure. I communicate throughout the procedure and let the patient know at any point, okay, a touch here, a touch there, or something like that. So there's no surprises. And these points I feel like are some of the biggest points to help decrease the difficulty of this exam for a lot of patients. I've certainly had patients that said they've never been able to tolerate any sort of exam, any sort of pap smear or colposcopy or whatever the exam might be, but just going through these simple tips of communication or asking for these simple tips of communication can make all the difference in the world. But for some, that may not be exactly enough, and they might need other things such as medications, and there are a few options for it. If somebody really has difficulty with that initial penetration of the speculum or anything, what might be helpful is to get a lidocaine jelly, which you could put on to that opening of the vagina just prior to your exam. Some offices might actually have this for you, and you could just ask to see if this would be beneficial, because it certainly, again, has helped some of my patients. Some people have asked me about, can you spray the cervix before you do the pap smear? Now, this one we really don't necessarily do, because that if we're doing a pap smear, this could obscure the reading of the cells and may not be the best thing. And with the tool that we use in our clinic to collect the sample, the brush, it's a quick quarter turn of a very soft brush that often patients don't even notice. Now, it's certainly some do notice it, but again, there's really not a good option for numbing the cervix without potentially disrupting the test. And if the test is disrupted, you don't know until a few days later. And so these topical medications to the outer vagina might be useful for some. But again, we can escalate that up to if somebody wants to pre-medicate with a medication like an anti-anxiety medication. This is certainly okay. And again, something you're going to have to talk to your provider about, because these are prescribed controlled substances. But if someone wanted a lorazepam or an Ativan type medication or Valium, those could certainly be prescribed to potentially make that experience better. But in these situations, if someone's taking that medication for the first time often, you might need something like a ride home, so bringing a friend with you to give you a ride home. I hope that opening this discussion can hopefully at least help one person out there feel comfortable enough to go in, to talk to their care team, and get these life-saving tests done. Because again, for all the cervical cancer cases, about half the patients that get cervical cancer are because they've never had a pap smear before. So again, this is a life-saving test. And so if you have anything that maybe helped you, or you have any questions about something else, leave it in the comments, because that could help someone else in turn. We'll be talking likely about cervical cancer screening guidelines, how often you should get it, and it varies a lot based on age or other risk factors. So if you have any questions about that for me to address in the next video, let me know. Have a good day, everybody.